Hello, everybody. I'm doing my reflection for the role play number two. My technique was CBT, so some cognitive behavioral therapy, and just a couple things. I'll explain like why I did certain things and what I maybe would have done a little bit differently had it been like a legitimate like hour-long session. So. We started with a thought recording. We do a lot of thought recordings in partial, so this is something I'm pretty familiar with. But the nice thing about thought recordings are like, every situation is different, every kid's different, every thought is different. So it's like cool to see like different people, working through some of these. So I didn't actually prep for this to be our like I didn't plan a situation. Lauren just went ahead and like wrote a situation out. So I really didn't know what I was walking into, which was kind of cool because that's how like a real therapy session would be. But so we worked through the thought recording. Had it been an hour-long session, we would have like written it out together. But obviously there wasn't time allotted for that, so we pre-wrote, like she pre-wrote it up there. I would explain like, what the purpose of a thought recording is to kind of analyze. And I kind of did that already, but I would maybe take a little bit more time with it, saying like, okay, so the situation, that's the facts, that's the who, the what, the where, and the when, and then talk about why we don't put the why in there, because the why is kind of like in the thoughts. But obviously I didn't do that for time purposes. Another thing, when we kind of worked through the thoughts and I would have encouraged her, to list more than I think we only have like 5 or 6 thoughts, like many thoughts as you can, like out and kind of process through each of those thoughts. I didn't process each one of them so specifically just because of time stuff, but in an hour-long session I would have done so. Also, when I gave Lauren the paper for that had the cognitive distortions on it, I would have taken the time and worked through each one of those to make sure she had like a good understanding of them. But it also is good just to see where they're at, like if she was able to have like some insight and recognize what distortions she was having or if she struggled in any way. So I would have taken more time with that. But 17 is a lot to go through. I would have also probably like divided them into like maybe I kind of talked about it like let's focus on 3 this week and then 3 next week, or as many as she wanted to kind of focus on. Overall, I think it went pretty well. I think that's how a lot of the individual sessions at Partial kind of go. The difference is that they learn these skills in groups, and then they really can apply it more independently and effectively in their individual sessions or family sessions, for instance. But assuming that your kid's not in like a program like this and you're just seeing them, outpatient once a week or once every 2 weeks, you would kind of have to teach those skills. So I think it's really important that, as counselors, we know how to teach the material. Especially with like the thought distortions and things like that. Like that's not stuff people generally just come in with knowledge of. So just something to consider. I think that Lauren did a really nice job. Like again, we didn't really plan this. We were just kind of like, oh, let's just go with it and see what happens. And I think she did a nice job kind of owning up to the things, to her behaviors and things like that. Kids aren't always that forthcoming. Sometimes they struggle to know, like, to see that things are irrational, that mom and dad taking their phone is, a punishment or a consequence, not a punishment, of their actions. So she did a really nice job with that. So I'm thinking that for maybe my next role play, she'll probably still utilize Lauren. She's very helpful. She's one of the therapists here, and she's gone through Waynesburg's program, so she's pretty familiar. But I kind of want her to be maybe like a little bit more teenagery, maybe a little bit more defensive, and kind of make it a little bit more difficult rather than this like very easy client that is like, oh yeah, like I understand why she did that. So I'm going to talk to her about for the final role play, or I think there's 2 more. So for the next role play, making it a little bit more difficult depending on, what we can come up with. Thank you guys.